This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Carotid artery disease develops slowly and increases your risk of stroke. So can you prevent it? How is it treated and who is at risk? Let's find out with Dr. Sarah Hanari, a vascular surgeon at Dignity Health. Dr. Hanari, thank you so much for your time. So first off, what exactly is carotid stenosis?
Carotid stenosis, or carotid artery disease, is based on the carotid arteries, which are two main arteries that carry the blood from your heart up through your neck to your brain. So typically with age, these arteries can build up plaque, mostly made up of fat and cholesterol, and this plaque can narrow the inside of the arteries, and the plaque can further travel to the brain if it breaks off, causing a stroke.
So are there any symptoms associated with this?
So symptoms of carotid artery disease are actually no symptoms in the early stages. A stroke could be the first sign of this condition, and strokes can typically have warning signs referred to as mini strokes or TIAs, transient ischemic attacks. So mini strokes are symptoms that are usually temporary. These can include weakness or numbness, tingling on the side of your body, also the inability to move a part of your body, problems with speech or vision, or problems trying to comprehend what others are trying to say.
Wow, so the first symptom may actually be a stroke. So if you do catch this in time, how do you diagnose this?
Diagnosis is actually simply done with an ultrasound. We can take a probe with some ultrasound jelly, place it on the neck, and be able to evaluate the blood flow through these two arteries. Depending on how fast the blood is going, we can kind of decipher if there is some narrowing or stenosis. And if it's significant, then we would follow that up with a CT scan, and the CT scan would be able to determine specifically how much narrowing there is.
And then if someone is diagnosed with carotid stenosis, how do you treat this?
Well, depending on the severity of the narrowing, we decide whether the patient would be benefited by having surgery. And the surgery consists of actually going into the artery and cleaning it out and then patching it up. If the stenosis or narrowing isn't severe, then we closely follow the patient, make sure it's not becoming severe.
And then are there any ways to help prevent this?
Yes, some risk factors you can't change. You can't change your age, your gender, or your family history. However, obesity is a risk factor, so exercise can help. In addition, diabetes, high blood pressure, and high cholesterol are risk factors. And so controlling your blood pressure, making sure that your diabetes is well controlled and your cholesterol is low, is very beneficial. And one of the risk factors that's pretty severe is smoking, which can completely be controlled by a patient.
And you mentioned that this may be hereditary. So knowing that can alert you to potentially being at risk for this.
Yes, family history of atherosclerosis or hardening of the arteries can make you potential for not only carotid stenosis, but stenosis in other arteries of the body as well.
And then lastly, Dr. Hanari, is there anything else we should know about carotid stenosis?
I think it's beneficial to be screened or be evaluated by your physician. And if there is any family history or high risk factors, to have an ultrasound and see a vascular surgeon.
And that's good advice. Dr. Hanari, thank you so much for your time. This has really been informative.
Thank you.
That's Dr. Sarah Hanari. And for more information about this, please visit dignityhealth.org/Bakersfield. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.